This is a Black Nouveau web exclusive. I'm James Causey with Black Nouveau. Recently, UW Milwaukee Center for Economic Development released an 18-page report, Milwaukee Coronavirus Racial Divide. The report says race and patterns of segregation are closely associated with the spread of COVID-19 in Milwaukee County. We are joined now by Dr. Joel Rast, the author of the report. Thanks for joining us.
Good to be here.
So, how close does the spread of COVID-19 overlap with race and patterns of segregation in the city?
Well, it turns out that it's a pretty close association. So we looked at areas of the city that are predominantly African American, that are at least 75% African American, and then areas of the city that are at least 75% white. And what we found is that looking in particular at coronavirus clusters, so these are census tracts where there's at least 10 confirmed cases. So a census tract, for anybody who doesn't know, is it's a geographic unit that the Census Bureau uses to sort of track information. It's usually about several square blocks in size. Milwaukee County has about 200 census tracts. So we looked at census tracts that have at least 10 confirmed cases of coronavirus, and it turns out there are 36 of those census tracts in Milwaukee County, or there were when we did our analysis. And so what we found was that more than two-thirds of those coronavirus clusters were in predominantly African American neighborhoods. And these are areas that have at least 50% Black population. But if we look at those clusters in white areas that are at least 75% white, only 3 out of 36 of those clusters were located in those areas. So it's a pretty stark disparity that we found.
So we're seeing, from early numbers that Blacks account for 27% of the county's population, but 69% of the COVID-19 deaths. Why does that happen?
Yeah, so there are a number of key risk factors for the coronavirus. A healthy person, a person who's otherwise healthy who gets the coronavirus has a much better chance of not, having serious complications than somebody who has some pre-existing condition. And the key ones are diabetes, heart disease, hypertension, and obesity. And those 4 conditions are more prevalent among African Americans in general than they are among whites. So the question is, why is that? Why do we see that? Well, segregation, I would argue, has a lot to do with that. Segregation and lower income among many African Americans. So it means, for example, that if you have lower income, you may not go to the doctor for regular checkups because you don't have health insurance. You don't have money to pay for that. That may mean that if you have some condition, such as hypertension, for example, you may have that condition for quite some time before it's ever discovered because you haven't gone to see a doctor. So it's become a serious condition now that has not been treated for some time. The same goes for heart disease and potentially diabetes as well. It's that sort of lack of regular access to healthcare that can cause these conditions to go on for a while before they're discovered. The other thing is, just sort of basic access to good food. Areas that are low income, predominantly African American, may not have a grocery store nearby, and people living, in that neighborhood may not have a car. So the question is, do you get on the bus and take the bus 2 miles to get to the pick and save, or do you run down to the 7-Eleven and get something quick? It's a lot easier to run down to the convenience store. So the lack of sort of healthy food options also plays a role in this.
Right. At last count, 19 cases of COVID-19 was tied to in-person voting. Do you expect those numbers to continue to rise, and how should that have been handled differently?
Yeah, I mean, it's very unfortunate that that situation ended up playing out the way that it did, because it exposed a lot of people put a lot of people at risk for contracting the virus who really didn't need to be. So, we can't really predict how that is going to play out. A lot depends on how careful people were being while they were waiting in line. Did they wash their hands after they touched a pen that somebody else had touched? Were they wearing masks? All these things will play a role in how many new cases that we end up seeing as a result of the in-person election.
We're also seeing clusters on the city's south side with COVID-19. Have you been able
Right.
to draw any commonalities between the north and south sides?
Well, I think that the one commonality that we see in cases on the north side and cases that are emerging on the south side is that these tend to be areas that are more sort of modest income. And that kind of makes sense because we know that areas that are high income are places where a lot of people have the opportunity to work from home, to practice the social distancing that they're asking us to do. These are people who have their own transportation, they have their own cars, they're not getting on buses. They probably, in many cases, live in single-family homes where they're not encountering neighbors on a regular basis. But you look at more modest income areas, Latino areas, African-American areas on the north side. Many of these individuals are working in jobs that require them to actually report to a job. So a bus driver or a cashier in a grocery store. And that, of course, exposes them to the virus. It increases their risk. So essential workers are needed so that people with higher incomes can have the necessities that they need to stay home, right? They have groceries. They can get other things that they need. But that depends on these more moderate income workers going out and taking certain risks to do their jobs.
There's a lot of misinformation out there on the spread of COVID-19. One of the things that I'm hearing a lot of is some people are attributing 5G towers and access to 5G technology to the spread. Can you clear that up?
Well, there's no real evidence that that is the case, so that not that I'm aware of anyway. So I think people have to be very careful about the sort of information that they see and hear, and try to confirm that. If it sounds like something a little questionable, then it might be wise to try to get some more information about that to see whether it's really true. I mean, one of the things that has been reported about the spread of coronavirus in African American areas of the county is that it took a little bit of time in some communities for people to take it seriously, that this was not something that was immediately recognized as a serious problem that had to be acted on. And it may well be that there was some misinformation out there that contributed to that. So I think it's going to be very important that communication about what should be done to keep people safe and what's going on in terms of how the virus is spreading, that be done effectively so that people really do understand what's happening.
Tell us how to get a copy of your report.
So The easiest way to find our report is to go to the website of the UWM Center for Economic Development. So you can Google UWM Center for Economic Development, and that will pop up right away in your Google search. And on our homepage right there, you will see the report. And you can click on a link and you can download the full version of the report.
Thank you, Dr. Rast, for joining us. I appreciate it.
It was a pleasure. Thank you for having me.
We will have more on this topic on the next edition of Black Nouveau, which will air May 7th at 7:30 a.m. on Channel 10. Thank you.